Hi guys, I'm Danny West. Welcome back to another episode of the Soapbox, your patient education station. And today we're talking physio first aid for shin splints, okay? So this video would be for you if you find like you've been doing a lot of maybe jumping, running activities, and you're noticing some pain in and along the front of the shin bone here. Now, we're gonna go through a little bit of cupping technique and also chat about taping and footwear. And these easy things can be a good start for you, again, while you're waiting to get in to be assessed. So if you're getting pain along the shin, I want you to notice, is it, if you feel for your shin bone, is it more on the outside part of the shin or more the inside part of the shin? Because it makes a difference. So technically, true shin splints, by definition, are actually little microfractures of the tibia. And if we walk down a little bit of anatomy review here, this is my right foot. Tibia is the big inside bone that we can feel. The fibula is right on the outside. Can't really feel it, but it has muscle on top of it. So true shin splints are little microfractures of the tibia. Now, in all the people I've seen with shin splints, I've never actually seen true shin splints. A lot of them do quite well with change of footwear, mobilizing the ankle, and also releasing a lot of the tissue in and around the shin. So what ends up happening, even if it's like kind of pseudo shin splints, is the muscles usually on the inside, but it can be the outside too. Usually the muscles on the inside, because some of them are tucked right in close to the tibia or the shin bone, they'll start tugging on the lining of this bone called your periosteum. And it's that kind of gets ticked off and can mimic kind of shin splint-like symptoms. So for ease of diagnosis, shin splints is a name or a term that gets thrown around a lot, but just know that true shin splints is technically little microfractures of the tib, but usually it's the tugging of the periosteum from those deep muscles that are technically causing the problem. But just know they're technically not true shin splints. But if you notice pain, okay, yes, I do have pain more on the inside. It might even be a little bit farther down. That's what we're going to focus on with massage with the cups. If you're like, no, Danny, it's mostly like on the outside, then focus more on the outside for this release work, okay? So I'm going to put a bit of cream on. And you can do this with your hands, but I also find like the cups just really effective because sometimes these can be quite tender. So I'm going to make sure kind of my foot's relaxed. You can even have the leg down or propped up. But I'm just going to start to kind of massage in and along the shin. So I'm not right on the bone. I'm just kind of right along the shin bone here. And this would be if the pain is primarily on the inside. And you don't have to go super hard, nice and gentle. But I'm going the full length of the shin, kind of putting pressure and then easing off. And you might notice a few little bumps or tender spots along the way. Now, if you do have cups, it's just an expedited version of that. So maybe I'd put one cup on the upper part. Ooh, and even that's a little tender on me. And then I could put a cup on the lower part. And I don't have shin splints, but this is quite tender. So again, with the cups, try to ease up how much pressure you're putting on. The goal is not to cause pain or cause bruising. That can be a side effect, but that's never the goal. It's to get a little bit of fascial release in through there. And then I would set a timer. I would leave those on about 5 minutes. And again, if you were having pain more on the outside, you could do the cups on the outer part of the shin, okay? So try to cup consistently, maybe every second day for about a week, just to try to loosen up, again, those muscles tugging on the bone. Now, the taping technique that I really love is a K-taping technique. And just a little disclaimer, I am not a certified K-tape instructor. I did learn this when I did K-taping, but just know that I'm not a certified instructor and I'm not a representative K-tape. You can use any dynamic tape. I'm using T-Max tape, which I find works really well, but you could also use like KT tape, any rock tape, any dynamic tape at Shoppers. So again, you're gonna kind of prop your foot on the floor so your calve is relaxed. You're gonna put a hand on either side of the shin, and I want you to kind of pull up in opposite directions. So I'm gonna pull up the outside and push down on the inside, and then switch. And I just want you to notice which one you like better. There's no right answer or wrong answer. It's, oh no, I kind of like the feeling when I pull up on the outside and down on the inside. And it might be the opposite. But take note which one feels good for you. Because then we're going to take 2 long strips, they might be pre-cut for you, and we're going to pull them in that direction. So if you liked, okay, I like the outside up, the inside down, I'm going to start with 1 strip, rip it at the end, and I'm going to go off the outside of the shin, just kind of lay it on there. And then here's a little fascial technique for shin splints. You're going to pull, place, pull, place, pull, place, pull, place. And I made this a little long, but basically just cover the length of the shin. Give it a little rub. And now we're going to go pulling down on the inside, starting from the top. Okay, so I'm going to kind of hold it like so I'm not touching the adhesive. Pull, plant, just kind of every inch or so, pull, plant, pull, plant, pull, plant. And again, if I have a little extra there, I can just trim it. And then just give it a rub. So that's step 1, is doing our long strips. Now we're going to do 2 Y strips across. So I've taken, if it's pre-cut, you can take a pre-cut strip, and I'm just going to cut it down the middle so it's a little Y strip. And if you have the big long roll, you can just custom cut that. They don't have to be very big because we're going to stretch them across. You can do the same thing going across, is like, do I like that feeling or this one? And I'm just going in opposite directions. Okay, I kind of like the feeling of this. If you don't have a preference with that one, I find a lot of people don't, just pick away, okay? So we're going to take 1 Y strip. I'm going to rip the base. And I'm going to go not quite to the bottom, but midway up. I grab my ends, and I'm going to go pull, place it on. Pull, place it on, pull, place it on. Almost like reins. And now if I went that way with that one, I'm just going to do the opposite. Up top, rip the base of the Y, like so. Again, I'm not going to the very top, just kind of down a little bit. Grab your ends, so you're right at the tips, you're not holding the adhesive. Pull, plant, pull, plant, pull, plant. And I just want to make sure that the ends of my Y strips stick on skin, because if they just stick to the tape, it just won't stick very well, and I just give that a rub. This is one of my favorite tapes ever. I don't even have shin splints, but this just feels nice, okay? And again, you don't have to do it multicolored. You can get skin-colored tape as well. I would say put this on for any activities. I would say no running, no jumping, or no excessive running and jumping, because that's what's bugging the shin right now. But I would have them tape for any activities, okay, just to kind of support it. And it feels quite nice. So cupping, tape to support. The third thing for at-home treatment that's really easy to get a start on is just making sure you're wearing good footwear, okay? Dance is tricky with this. Dancers, because we don't have supportive footwear or like a good runner that we can use, we have to make sure I'm assessing like how they're landing from a jump, their ankle range of motion, their hip strength, all these other things, because we can't really just rely on shoes. But say you're a soccer player, say you're somebody that's just getting a little more into running with all the nice weather out, please make sure you're not running in super flat shoes. For an example, Tom's fashionable, not the greatest, neither are these, okay? These are my shoes, but this is an example of a bad shoe. Be totally flat inside, nothing to this shoe, okay? It's just like a flip-flop. There's nothing super supportive, and we want something a little bit cushiony to again help absorb the force as we're walking so the shin is not taking the brunt of the force. So I would be looking for something with kind of a cushier sole, a good runner. I really like Asics or Sauconys. And then I'm also looking for something with a little bit of an arch support. So you'll look in the shoe and you'll see like a little bump. That's really great. I find in the new Nikes, they don't have a lot to them, like they're pretty minimalist. You can also try some kind of arch support in the shoe if you don't want to run out and buy new shoes, but you should be wearing something relatively cushy and supportive as much as you can while you're dealing with the shin splint issues, okay? There's also other reasons they're being caused, but again, this is just to get you started. A physio would also assess hip, knee, ankle to see if there's any breakdown along the way that could be causing more pressure on the shin, okay? So yeah, those are my top 3 tips. Start with those, and like I said, get in to see someone to get it further assessed, okay? But you're gonna love this tape, so enjoy. Thanks, guys.